The People's Pharmacy podcast is supported in part by CocoVia. CocoVia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
CocoVia now comes in an even more concentrated formula with 450 milligrams of cocoflavanols, 5 times more than the leading dark chocolate bar and 15 times more than the leading cocoa powder.
CocoVia has a proprietary process that preserves cocoflavanols at the highest levels, and the product undergoes rigorous testing at every stage, which allows them to guarantee the highest level of cocoflavanols per serving and to provide the purest, highest quality product possible.
People's Pharmacy listeners can now try CocoVia for 25% off by using the code Peoples25 at cocavia.com. That's COCOAVIA.com. Doctors have to see more patients in less time than ever. As a result, patients are often interrupted in the middle of their stories. This is the People's Pharmacy with Terry and Joe Graydon.
The coronavirus pandemic has made a bad situation even worse. When the healthcare system is under siege, there's much less time to communicate. Our guest today, Dr. Sonia Rappaport, practices holistic medicine. She treats medically complex patients with undiagnosed or hard-to-treat conditions. Listening to their stories is crucial.
We'll find out why narrative medicine is gathering momentum.
Can this approach help bridge the gap between complementary therapies and science-based medical practice?
Coming up on the People's Pharmacy, the importance of telling your story and the power of holistic medicine. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
We know that the coronavirus is dominating the news, appropriately so. Today, though, we're going to talk about something else.
How do doctors figure out what's wrong with a person and how they can be treated effectively? Traditionally, medicine has put great emphasis on the patient's history, which usually means the patient has to tell a story. What hurts? When did it start? What happened next?
One drawback of the way medicine is currently practiced is that doctors don't feel they have enough time to listen to someone tell the whole story. But that may be necessary to get the complete overview they need in some circumstances.
Our guest, Dr. Sonia Rappaport, is a proponent of narrative medicine. She's a functional and integrative medicine physician whose practice, Haven Medical in Chapel Hill, North Carolina, focuses on environmentally acquired illnesses. She treats medically complex patients with undiagnosed illnesses and complex disorders such as mold illness, Lyme disease, mast cell activation syndrome, chronic fatigue syndrome, EDS, and POTS. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine. She's also an expert on tea and health and a certified tea sommelier.
Welcome to the People's Pharmacy, Dr. Sonia Rappaport.
Thank you, Joe.
Dr. Rappaport, it seems as though there are a few conflicting or potentially not conflicting, but definitely different aspects in medicine. We've got big data on the one hand, and there's a lot of usefulness for having all the possible data for making diagnoses and following treatment. On the other hand, you've got narrative medicine, and I'm hoping you'll be able to tell us, first of all, what is narrative medicine, and second of all, how do you integrate those two?
Thank you, Terry. Narrative medicine is a way of engaging with a patient where we listen to the story, and it recognizes that illness has a narrative, and narrative medicine starts by listening to what the patient is telling the physician about their symptoms and how they evolved, not simply as a way of filling a checklist of the symptom, that symptom, that symptom, but listening to it as a story, and a story the way novels are stories. It allows the physician to focus on the patient as a person and not a set of symptoms and data point sets. So I think narrative medicine enriches the patient-physician encounter. It enriches the relationship. It helps create that relationship. And without the narrative component, medicine is really just about big data. My concern is that if we forget about that doctor-patient relationship and the engagement as two humans together, we'll end up with vending machines where you put your hand in, it collects all your data, it spits out a pill that you need. There was a study of, I believe they were rhesus monkeys as infants that were fed normally with their mothers, and another group that were taken from their mothers, and they were fed through bottles and wire cages, and a third set where the bottles were surrounded by a terry cloth material in the shape of a mother. And the infant monkeys that did the worst clearly were the ones that were fed just with bottles in a cage. The ones that were at least given the shape of a mother did a little bit better, but the ones who were with their mothers did the best. They all got the same nutrients, but what really was different between the three groups was the touch and that nurturing and caring.
Dr. Rappaport, medicine goes back thousands of years. I mean, Hippocrates, the father of medicine, and probably long before that. So when we think of healers, we think of hopefully caring individuals who are trying to help their families, their friends, their tribe, their neighbors, and they were using all kinds of things. They were using herbs. They were using probably psychological suggestion. They were probably using chants. They were using everything that was available to them. Well, here we are, modern medicine, and you've been trained as a modern medical doctor. And these days, a lot of times, people kind of look down their noses at those old, quaint home remedies that were used hundreds or thousands of years ago, herbs and berries and things. I'm wondering how you have managed to integrate, if you like, modern medicine, pharmaceuticals, and older healing traditions, and how this got started in your medical education.
When I was a medical student at the University of Virginia, I started a club called Alternative Perspectives in Medicine, and one of the people who spoke, later went and worked for a little bit, was a Native American medicine man. And he taught me once that if you have a Native American as a patient and you tell that individual, if you need to prescribe something, to take the pill under a tree, they will do better than if you just say, take this twice a day. What he was teaching me was to incorporate the culture, the background, the belief system of the individual. And I think that's really critical. And that's what those old ancient healers all through our history have done, is they've been a part of the ill individual's culture, and they've incorporated those cultural beliefs. Today, we see people from a broad spectrum of different cultural backgrounds, and there's the idea of trying to be culturally sensitive, but so few clinicians have that training of being able to incorporate where someone is coming from. And I think that's a really critical, important part of care, is to hear the patient's story and to build the treatment protocol around that. I have 4 children, and my 2 youngest children have a genetic disorder called familial dysautonomia, for which there are very few treatments. When I was the one who made the diagnosis, and when I made the diagnosis, I started evaluating and looking at anything I could. And one of the most important things I did was to start looking at nutrition and start looking at herbal remedies. And I found things that had never been written, but work in my children. The other thing that I did that I think was vitally important to address your second point about psychological components is I've taught my children from the beginning that even though they officially have a disability, they're living in an enabled world, and I want them to live as optimally as possible. And so I believe in them, and I teach them that they can do things, and then they do. And the same is true for patients, that if I speak to a patient about something that I've seen work in other patients, I will share that so that they have more confidence and understanding and belief. There's a really wonderful technique developed by a woman by the name of Annie Hopper called Dynamic Neural Restructuring System, and it teaches one to reframe how they think about things. And it, going back to your question, Terry, about the big data, my concern with people focusing so much on big data is that their illness becomes their focus. And what DNRS teaches is that life is the focus, and it helps reframe and restructure how people think. And I've seen it do miraculous things for patients.
It almost sounds as though one of the things that you can do with your narrative medicine approach is change the story. Help people change how they see their own story.
Absolutely. A lot of people carry the concept that I think is incorrect, that there is one truth of what happens. History is history.
It's my truth.
Exactly, exactly.
Mine is better than yours, too.
Yeah, right. And not only does my truth, when we leave today, we will all three have very different memories of what today was like, but in a year, mine will be different than it will be today because our memory changes. I teach patients who've dealt with past traumas that you can reframe that trauma by writing a new story around that event, writing a new narrative. Not that it doesn't happen, because you can't erase the past, but that something happens differently. If something happened to you when you were 8 years old, 8-year-old you is still hurting. And PTSD is one example of that. Cognitive behavioral therapy does not tend to do well for PTSD, but narrative medicine, rewriting, is a way of shaping that so that 8-year-old you has another story that she can listen to and heal.
Does it make a difference whether the person actually writes it down or talks about it?
I think it does. I think writing, and I usually will recommend that people do what I call a free write, where they write for 15 or 20 minutes without stopping, no crossing it out, no lifting the pen up off the paper.
No looking up words in the dictionary.
None of that. It turns off the filter and things come out in writing. The hand is connected to the brain, and things come out when we write by hand that are really unique. I've had some patients, instead of writing, create art, and they paint or they watercolor, and then they go back and they do it differently, and it can be very, very powerful.
You're listening to Dr. Sonia Rappaport, a functional and integrative physician. Her practice, Haven Medical in Chapel Hill, North Carolina, focuses on environmentally acquired illnesses. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine.
After the break, we'll hear how Dr. Rappaport integrates modern medicine with alternative medicine.
Randomized controlled trials are crucial for learning about effective treatment.
But what about case histories?
Can a patient's story help the doctor prevent or treat the underlying problem rather than just the symptoms?
Find out how we can get our bodies back into better balance.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. Kaya Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today we're talking about integrative medicine. How can you and your healthcare provider establish a dialogue that allows you to fully tell your story? By doing so, will your doctor better understand you and your illness? Getting the full story would be useful in a situation that's complex and hard to understand.
Our guest, Dr. Sonia Rappaport, is a functional and integrative medicine physician whose practice, Haven Medical in Chapel Hill, North Carolina, focuses on environmentally acquired illnesses. She treats medically complex patients with undiagnosed illnesses and complex disorders such as mold illness, Lyme disease, mast cell activation syndrome, chronic fatigue syndrome, EDS, and POTS. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine. She's also an expert on tea and health and a certified tea sommelier.
Dr. Rappaport, there seems to be a lot of, I hate to say it, but divisiveness in our world, whether it's political or economic or even especially perhaps in the health field. So there's like mainstream medicine, modern medicine. We've got all the tools. We've got the drugs. We've got the tests. Oh, and then there's this other thing they call alternative or integrative medicine. And it doesn't have much science, and it's, herbs and home remedies and silly stuff. And so this world doesn't come together very well. There's not like a meeting place, and yet your career seems to be a meeting place. So tell us how you ended up as what some might call an integrative physician, and how you actually integrate these two worlds.
Well, I entered medicine with a degree in anthropology. So I've always been interested in other perspectives, other ways of doing things. I went to medical school and thrived in my last 2 years on the clinical floors, much more than my first 2 years with the basic sciences. And so when I went on and started my career, I probably couldn't even begin to tell you what the Krebs cycle was, which is a way we make energy. When I diagnosed my children with their medical disorder, I started trying to find answers for them. And it sent me back to basic biochemistry, molecular biology, back to the basic science. And I found answers, I found ideas, but there wasn't a good treatment option in my medical doctor toolkit. And so I had to create them. I used to say I'd move mountains for my patients and I'd move the earth for my kids. And so I started looking at everything. And it was a little frightening at first. The first time I gave my son a homeopathic remedy, I double-checked it 4 and 5 times before I gave it to him. And within half an hour, he was better.
Dr. Rappaport, I don't know if we all understand what a homeopathic remedy is, so perhaps you'll explain that as well.
Hippocrates wrote that we can cure with similars and with dissimilars. And what we do in modern medicine or allopathic medicine, if someone has inflammation, we give something that is an anti-inflammatory to stop that process because we think that we accurately think that it causes the symptoms, but it doesn't address the cause. With homeopathy, one believes that the body is trying to get to cure, but is stuck on the symptoms. So if you propel the body forward with those symptoms, with that process, it'll get to cure. An example I give patients is if someone drinks too much coffee, they might get jittery, may not sleep well, they might get diarrhea, their heart will race. Well, if one has a viral stomach virus that has those symptoms, if you take a homeopathically prepared version of Café Cruda, it would potentially make all of those symptoms go away by pushing the body in that direction. Homeopathy is just one small piece of complementary medicine, and I prefer the term complementary because it's not an alternative, but it rounds out and adds more tools in my toolkit of ways that I can help my children, but also now in my practice, my patients. And that's one component of what we add.
You describe observing how your child reacted to this remedy, and a lot of times your colleagues don't trust that sort of thing. It's like, well, that's an experience. That's not a randomized controlled trial.
You mean an anecdote, don't you, Joe?
Yeah, an anecdote, an experience, a case report. It's not scientific. We like FDA-approved medications because they've gone through randomized controlled trials. And we sometimes mention, well, yeah, but if we required randomized controlled trials for everything, we wouldn't have any parachutes. You know, we don't want to do RCTs with a parachute. And that's actually been written up in the British Medical Journal, the BMJ. But the idea of putting, for example, very finely ground black pepper on a cut that's bleeding, do you need a randomized controlled trial if when you do that, it stops bleeding? I mean, either you're bleeding or you're not bleeding. So I'd like to get your perspective on this concept of experience, anecdote, case reports versus RCTs, randomized controlled trials.
So I wish that randomized controlled trials were as scientifically clean and clear, and the data produced and the articles and literature produced were as clean and clear of bias as we all think it is. The reality is that there is a tremendous amount of bias that is introduced by the funding companies, which are typically pharmaceuticals. Some data is not reported, as we're finding out now. There was an article in JAMA probably about 5 years ago that looked at antidepressants and their use in depression. And what it found, it was a meta-analysis of a lot of literature. And what they found was that from mild to moderate depression, antidepressants were no better than placebo. For severe depression, it was very useful. But in looking at the depression rating scale, the studies that actually reported the full information did not really show a difference. The sad part of that one particular meta-analysis was that the number of papers that they could look at, they could include in their meta-analysis was so small because the majority of the literature did not report what they needed to have reported. So I think that there's great value to testing, especially when we're creating pharmaceuticals that we think we're going to block this enzyme, but the reality is we're blocking that enzyme, but it's having a lot of other downstream effects. So we have to understand more than what the lab is telling us what the effect is. So I think randomized controlled trials are useful and important, but medicine is variable. And we are continually learning from our mistakes. When I was in medical school, I was taught that every woman going through menopause should be on Premarin and Provera. And then all of a sudden the brakes were applied and no woman should be on Premarin or Provera. And so how we treated our patient varied literally from one day to the next based on a large trial called the Women's Health Initiative.
And of course, the likelihood is that some women do better if they get that hormone replacement therapy, and other women don't really need it and are better off without it.
Exactly. And those trials were based on Premarin, which stands for pregnant mare urine. It's not identical to the estrogen hormone that women have, and Provera, which is a progestin and not progesterone. And so those trials were based on synthetics and not the bioidentical hormone replacement, which studies in Europe have shown are of much greater benefit. But there isn't a lot of money in the bioidentical, so there isn't much research being done.
Right, so we don't have a big study like that to say whether or not there's any harms associated with them as well.
Exactly.
Trying to figure out what causes a problem rather than treating the symptoms is a bit of a challenge. You mentioned that we have things like anti-inflammatories, antidepressants, antibiotics. I mean, we can get down a whole list of antis. And sometimes you say, well, what's the cause? And how do we perhaps prevent this problem? I like to think of the idea of preventive medicine as being, what we should be focusing on, if at all possible. And yet there's not a lot of money in prevention. In other words, the pharmaceutical industry makes, hundreds of billions of dollars every year with with treating, symptoms and some of the consequences of the condition. But we don't have, for example, a lot of money supporting health coaching, helping people lose weight, helping people exercise more, helping people eat foods that might be healing rather than causative. So how do we move from this model, which seems to be we've got a pill for every ill, to more of a let's see what's underneath, what's the cause, and perhaps even more important, how to prevent it in the first place?
I think there are two ways we do that. And I think they've both started. In the 1930s, I believe, I don't remember the exact date, when insulin was first identified, maybe the 1940s, that came out of a lab, that came out of clinicians. Much of the advancements that occurred in medicine came from physicians. Now, because of the internet, because of communication between individuals, a lot of self-help groups and groups that form around a particular diagnosis, people share information. And I would argue that a lot of our advances are actually coming from patients, from patient communications, and awareness is coming from patients. So that's, I think, one way. The other way that I think we get around the pill for every ill is a movement called functional medicine, where doctors are going back to their basic science and trying to understand, instead of making a diagnosis, which is a label, and a diagnosis can be descriptive, like chronic fatigue syndrome, and it can be what we call etiologic, describing what caused it, such as strep throat. Instead of just focusing on the diagnosis, functional medicine tries to understand what the body is doing and how can we get the body back into better balance. And there are doctors throughout the country who are studying functional medicine, and that's the way I practice in my practice. What I like to distinguish between with my patients is what was the trigger that caused their body to react and what is their body's reaction. Sometimes the trigger's gone. For instance, if someone has a traumatic event, that event's done, but they are still stuck in that fight or flight mode whenever they re-experience that sensory input that was from that first traumatic experience. And so the treatment isn't to get rid of the trigger. It's done. The treatment is to reset the body. Other times, someone who might have been exposed to a water-damaged building, they're living in a moldy home, they are inhaling mycotoxins and spores and mold fragments on a regular basis. And they're reacting with inflammation. So now the job is twofold. We have to reduce the inflammation and help their body reset. We also have to remove those inflammagens and get them out of that space. So thinking about what is the cause and then what is the body doing, how's the body stuck, those are two separate issues that have to be addressed. I have plenty of patients who are so sensitive that we can't go after that trigger because it would make them too sick. We have to stabilize them. And those more severe patients, there's really a lot of work about getting their body into better balance and getting it to calm down.
What sorts of things can you do to get that body into better balance?
So many different things. Generally, when the body is responding to an external trigger that's causing a problem, it results with immunological responses. With the immune system kicks in and people can get what's called mast cell activation syndrome. The immune system can get suppressed in response, for instance, to mold mycotoxin exposure. There is a somewhat commonly used drug called Cellcept, which is a drug meant to suppress the immune system people who've had transplantation. It is known as mycophenolic acid. That is a mold toxin. It was first identified through penicillium mold. So if someone's exposed to molds, I measure people and they have mycophenolic acid in their urine, their immune system is being suppressed. So getting their immune system back in balance. Neurologically, the brain, especially if the blood-brain barrier has been disrupted with traumatic brain injuries or infections, the brain can get inflamed, and then reactions become more significant. There are immune cells in the brain that can cause reactions. And so brain fog and anxiety and depression, and someone who's never been anxious before may be a response. OCD symptoms may be a response to infection. And then the third area is the hormonal area. The endocrine system also can really get disrupted when the body's trying to respond to something, it can get stuck with an imbalanced endocrine system. And I see a lot of people with low thyroid and fatigue, even without low thyroid, and problems sleeping, and problems with staying hydrated well enough. So their antidiuretic hormone levels are low, and yet their blood is really concentrated, and they pee all the time. They can't keep hold of some of the fluid that they drink, and that causes muscles to get in spasm. So you can get these cascade of symptoms, and the key is to figure out which of those symptoms are off, to work to get those in balance, maybe through supplying some of the hormones until we can get the triggers, reducing the inflammation, helping the brain.
You're listening to Dr. Sonia Rappaport. She's a functional and integrative medicine physician. Her practice, Haven Medical in Chapel Hill, North Carolina, focuses on environmentally acquired illnesses. She treats medically complex patients with undiagnosed illnesses and complex disorders such as mold illness, Lyme disease, mast cell activation syndrome, chronic fatigue syndrome, EDS, and POTS. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine. She's also an expert on tea and health and a certified tea sommelier.
And Terry, the idea of narrative medicine really means that the patient gets to tell his or her story fully, completely, without interruptions, so that the healthcare provider can understand what's going on.
Exactly, and I found it interesting that patients telling each other stories can be helpful.
Absolutely. And we do love randomized controlled trials. I want everyone to know that. Well, after the break, you'll want to hear what healing modalities Dr. Rappaport likes to use.
We'll try to clear up some of the confusion over healthy dietary patterns.
We'll find out more about chronic fatigue and how it can affect patients.
Sometimes doctors are skeptical about conditions that are tough to treat, like chronic fatigue, persistent Lyme disease, or chemical sensitivity. What can patients do?
What are the key principles Dr. Rappaport relies on when she's treating patients?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is brought to you in part by Verisana.com.
Verisana Lab offers home health tests that allow you to monitor your hormones and health conditions. you can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's uppercase PEOPLE. To learn more, go to verisana.com. That's VERISANA.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by CocoVia, offering plant-based nutrients in the form of cocoflavanols for brain and heart health. Online at cocovia.com.
And by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYABiotics.com.
Today, our topic is integrative and narrative medicine. We're considering how alternative modalities can be combined with data-driven medicine for healing. How does modern medicine deal with hard-to-treat conditions like chronic fatigue syndrome?
Our guest is Dr. Sonia Rappaport. She's a functional and integrative medicine physician whose practice, Haven Medical in Chapel Hill, North Carolina, focuses on environmentally acquired illnesses. She treats medically complex patients with undiagnosed illnesses and complex disorders such as mold illness, Lyme disease, mast cell activation syndrome, chronic fatigue syndrome, EDS, and POTS. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine. She's also an expert on tea and health and a certified tea sommelier.
And Dr. Rappaport, we've been talking a lot about what's underlying illness, some of the triggers, the causes, talking about getting people back into balance. And I think our listeners would be very interested in some of your treatment approaches. So how do you go about helping people get back into balance? What are the various modalities? I understand, for one thing, that you are an expert in tea. Does tea have a healing place?
Absolutely does for some people. Teas and tisanes have been used for just millennia to try to help treat symptoms and balance. I tend to take a very personalized approach. I don't do protocols because everyone is different. And the first step for me is determining what kind of approach works best for an individual patient. I have had patients who do really well with herbals and others who just can't tolerate herbals. Some who do really well with pharmaceuticals. Others, they walk in a room with a pill and they'll react. So it really depends on the individual. Every treatment plan that I develop has to incorporate something about nutrition. Hippocrates wrote, "Let food be thy medicine and medicine be thy food." We are what we eat. And if we're eating lots of bad fats, then those fats get incorporated into our cell membranes. Cell membranes are fatty acid based. They can only be made with what we take into our bodies, and therefore we can have inflammation just based on that. So diet's an important part.
Well, let me stop you right there because it's such a controversial topic. I mean, the minute we start talking about diet, people go pretty crazy.
They say, paleo, it's the only way to go. Or they say, no, you have to be vegan.
Oh, Atkins is the answer. No, the best way is to be a vegetarian. No, vegan is the appropriate. And then, they'll come up with something else, South Beach. And so I think there's a lot of confusion, especially when it comes to fats. So we've heard for decades that saturated fat was the enemy. And that if you had coconut, for example, well, that's saturated fat, and that's going to be really bad. And the only good fats are the polyunsaturated sixes, the peanut oil and the sesame seed oil and all of that. And so can you help us understand a little bit about when you advise people with regard to diet and nutrition, and especially fats, which ones you might encourage and which you might discourage?
The first step is anything that makes someone feel bad is probably not a good thing to take. So it doesn't matter how healthy a food is. If someone takes it and feels bad, that should be off their plate. I don't think there's one diet for everyone at all. There are some people who thrive being vegan. There have been gold medal Olympic athletes who have been vegan their entire careers. There are other people who thrive on a paleo diet and shrivel when they eat vegetarian. I think one needs to know oneself. And it's not that an individual should be on the same diet the rest of their lives. The diet needs change over time and also depending on what's going on with their physiology. I've had patients who've come in to have a lifelong history of being vegetarian or vegan, and they develop severe fatigue, not because they're vegetarian or vegan, but because something else has happened. And at that point, they need more proteins than they need more meat-based proteins, I should say, because a vegetarian and vegan diet can provide plenty of protein. They need more meat-based proteins, and they thrive with that, and then they don't need it anymore. So what our needs are, I think, varies over our life, as well as with what's going on physiologically. Now, with regards to fat, it's the right balance. Our brain is 60% fat, and if we'd have unhealthy fats in our brain, we're not going to think well. Our cell membranes are fats. The nerves are covered with myelin, which is largely docosahexaenoic acid based, or DHA, which is an omega-3. So a diet rich in omega-6s and not sufficient omega-3s may make someone more likely to develop a myelin disorder or a neuropathy or having problems with numbness and tingling in their fingers and toes. It's such a variable thing that really should be individualized.
I find it interesting that your colleagues sometimes get caught up in what they like to believe is evidence-based medicine, but when the evidence contradicts their belief system, there's kind of a rejection, shall I say? So there was a study recently, Terry, and you're going to have to help me with this, but it had to do with vitamins and minerals and diets. And basically, this really large study, I think it was a meta-analysis of a bunch of studies, they said, well, vitamins don't do anything.
They don't prevent heart attacks.
That was the key measurement, that, if you took vitamins, you were wasting your money. And I think that's a pretty common belief amongst many of your colleagues. But they also found one other thing, and it never got reported. I mean, the headlines were, vitamins don't prevent heart disease, and everybody was, yeah, right, no good. Saturated fat.
Also, eating a diet very low in saturated fat does not appear to prevent heart attacks.
Which, of course, runs completely counter to what we've been told for 50 years. That didn't make headlines and didn't get reported.
Right. And I know that there was a study on vitamin E years ago because they thought this would be helpful in preventing heart disease. And they stopped the trial prematurely because the arm of the group of individuals enrolled in the study who were taking vitamin E did worse. In retrospect, they were giving alpha tocopherol, which is one type of vitamin E. Vitamin E also comes as a gamma, and there's some suggestion that the gamma tocopherol is more cardioprotective. And if you're giving a lot of alpha tocopherol, you're actually reducing your stores of gamma tocopherol. So I think the assumption that we know what we're doing is probably where things start to go off the rails. And with meta-analysis are considered the best kind of evidence-based literature. And I reviewed an article on the use of omega fish oil. And when you look at the individual studies that were done and delve into them, they had different doses of fish oil for different periods of time and different quality controls. So you're comparing apples to oranges to bananas to come up with a result. And I think sometimes the message is lost.
Dr. Rappaport, people come from all over the world to consult with you because you have a reputation for being able to help with mystery illnesses. I'm wondering if you could tell us a story about one of these patients, obviously conserving privacy, and how did you figure out what was going on, and then how did you develop a treatment plan?
One example that certainly I can start with is the one that's near and dear to me, is my third child, who was born with some neurological challenges. One eminent neurologist told me that he would be mentally retarded for the rest of his life. Another geneticist told me it's one of those things we'll never figure out. Go home and take care of him. And I refused to stop there. I started researching. Shortly thereafter, I gave birth to his little sister and was able to compile the two sets of symptoms who, when we went back to the neurologist and the geneticist, they said, yeah, it's nothing we'll be able to figure out. And I researched. I looked at the literature. I thought through what was going on. Is it neurological? Where neurologically is there a problem? It's not just neurological. There's also some of these other things. And so I ended up making the diagnosis in my own children, and the neurologist and the geneticist were wrong. My son is very bright. He's in college. So that's one story. Another story that I can think of would be a patient who came in to see me with chronic fatigue and a lot of allergies and couldn't tolerate many foods. And in asking that individual about their exposures, and in this case, it was getting more of a history and learning more about what their life had been, all the things that were contributing to her illness. I found that she had been living in several homes that had flooded and were water damaged. And when we measured some of the lab tests, they came back, some biomarkers of inflammation came back markedly high in a pattern that I see that's quite common when people are exposed to mold. I used binders to help remove those water damage building inflammagens, the mycotoxins, and she improved.
Presumably she also had to live in a building that wasn't water damaged.
Yes. Leaving the home was one of the first things that was on my list of things to do, and she was remarkably good at doing that and really significantly improved with moving, but that wasn't quite sufficient. We needed to add some other things to help her.
Dr. Rappaport, there are some conditions that a lot of doctors would rather not acknowledge, actually. Things like multiple chemical sensitivity, chronic fatigue syndrome, fibromyalgia, PANS or PANDA, mast cell activation syndrome, goodness knows, there's a few others as well. And essentially their attitude is, we don't have anything to offer these patients, first of all. Second of all, we don't even believe that this is what's wrong with these people. We think it must be psychosomatic. Give us your perspective, please.
I think it's incredibly rare for someone to feign illness, which is certainly what some of my patients have been accused of, that they're not really sick. And I think there's a propensity to say, if I don't know the answer, it must not exist. And I think one of the best teachings I ever learned was that we don't have all the answers. I think that clearly the patients I see, there are things going on in their bodies that are not in balance. There's pathophysiology. I do a fair amount of testing, and I do conventional tests that most primary care physicians don't do, and I see abnormal patterns and abnormal numbers based on those standard test results. There's a mantra that if you don't take a temperature, you won't find a fever. So if you don't do the study, it doesn't exist. It doesn't mean that it's not there just because you haven't studied it. And I think it's really unfortunate that people are exposed to that kind of perspective, that it's in their head. What I'll often tell people who have neurological and psychological symptoms is, well, your doctor was right because your brain is in your head and your brain is inflamed. And we do an MRI with neuroquant analysis, and I can show the areas of brain inflammation that are predictable patterns. And then I treat and I observe, and patient observes that they improve. So I think it comes from a place of lack of understanding, lack of knowledge, and fear.
In summing up today, Dr. Rappaport, I wonder if you could tell us about the few key principles that you rely on when interacting with your patients.
For me, the most significant principles in treating the patient is to honor and trust the patient, to listen to the patient, to think and not make assumptions, to think outside the box and leave no stone unturned, to trust instinct. There may be 5 different possible treatment options, and only 1 or 2 of them is right for an individual patient's care. In always investigating and trying to learn, I think it comes from a place of understanding that we know very little, and what we believe is true today in 20 years will be proved wrong. And so never underestimate how little we know. The body tries to heal, and it is my job as a physician to help that process. And sometimes it's my job to get out of the way so that the body can heal. Sometimes more is less. And finally, what I try to do is treat the cause of the illness rather than treat the diagnosis. I use diagnoses because that's the language we use in medicine, but the goal is to get an individual to feel better, and you have to treat the cause, or else you're going to keep treating the symptoms.
Dr. Sonia Rappaport, thank you so very much for talking with us on the People's Pharmacy today.
Thank you, Terry, and thank you, Joe. It's been a pleasure.
You've been listening to Dr. Sonia Rappaport. She practices functional and integrative medicine at Haven Medical in Chapel Hill, North Carolina. Her practice focuses on environmentally acquired illnesses. She treats medically complex patients with undiagnosed illnesses and complex disorders, such as Lyme disease, mast cell activation syndrome, mold illness, chronic fatigue syndrome, EDS, and POTS. She's the founding past president of the International Society for Environmentally Acquired Illness. Dr. Rappaport has an MFA in creative writing and has lectured nationally on narrative medicine.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits her interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome, online at verisana.com.
To buy a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1205. The number again, 800-732-2334, online at peoplespharmacy.com.
And when you visit our site, you can share your thoughts about today's show. Have you ever had trouble telling your story to the doctor? Or have you had a great experience?
Please tell us about it at peoplespharmacy.com. You can also sign up for our free online newsletter. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.